Thanks for tuning in to the Elevation Recovery Podcast, your hub for addiction recovery strategies, hosted by Chris Scott and Matt Finch.
Hello and welcome to episode 333 of Elevation Recovery. This is Matt Finch, your host, and in this episode, you're going to learn about Shivers, which is a relapse prevention technique that I learned from none other than Sheen. A while back, I watched a new interview with Sheen on the Knockin' Doors Down Recovery podcast. Sheen was one of my favorite actors when I was growing up, and I probably watched the movie Major League more than 25 times, and I never got sick of it. And in this episode, you're going to learn about a powerful RPT, relapse prevention technique, for early recovery, which Sheen uses as one of his tools to stay addiction-free. And if you know anything about Sheen's past, you might be thinking, what relapse prevention tactic could possibly work well enough and consistently enough to keep the winning tiger blood man away from his booze and blow? That is an understandable question and a fair one. Yet, I went to school for alcohol and drug counseling, achieved certification, worked in the field for years, transitioned to private practice addiction coaching 10 years ago. I've been learning and teaching topics of addiction recovery and relapse prevention for 11 or 12 years, and I have to say to you that Sheen's relapse prevention tool is super legit and based on human behavior, neuroscience, and psychology. I've also used a customized version of Sheen's anti-relapse technique in my own life, and in my opinion, it should be utilized by most individuals in early recovery. As properly executed, it can quickly dissolve urges to use substances you've previously committed to abstaining from. I'm going to assist you to identify the benefits of Sheen's RPT, break down the mechanics so you know the 3-step process to utilize and benefit from it in your own life, and help you discover where it fits into your early recovery plan, ERP. So buckle up and fasten your seatbelt. From fame to shame. Never in my wildest dreams could I have imagined that the Wall Street co-star I watched in the 1980s as a kid would be teaching me relapse prevention techniques 3 decades later from a small handheld supercomputer phone. But that day came, and for me, it's truly worthy of journalism. After seeing Sheen in so many movies I enjoyed and crushing it in the acting profession, along with his father and brother, eventually, I began seeing him in the tabloids for alleged issues with alcohol abuse, drug abuse, domestic violence, and other taboo behaviors, some of which were criminal behaviors. Dealing with an addiction is hard enough for people that aren't famous, but imagine the enormous additional stress from being addicted and trying to get unaddicted while the mainstream media is profiting off your health issue by slandering your name repeatedly, day after day, week after week, month after month, to boost their livelihood at your expense. They did it to Sheen and so many others. And back then, there was a much higher stigma with addiction, and there was a lot more shaming of quote-unquote addicts, a term I loathe, and it's not accurate, as addiction is a health disorder, not an identity. Nowadays, the stigma is still around, but it has lessened thanks to massive efforts by countless individuals, groups, institutions, and organizations over the span of many decades. According to Sheen, he was a people pleaser. His loved ones would ask him to go to rehab, and he would do it for them. And of course, since he was doing it for them and not him, it's no wonder why he continued to returning to alcohol and/or drugs after periods of sobriety. His loved ones and circle of influence would have some leverage to get him into substance rehab treatment. However, without self-motivation to quit and stay sober, this is often not conducive to lasting recovery from addiction. Sometimes going to rehab to please others actually works. Unfortunately, it usually fails, abysmally. I remember when Sheen starred alongside John Cryer in 2.5 Men, which I loved. But eventually, he was removed from the show, replaced with Ashton Kutcher, and that was the last I ever heard of Sheen and the last I ever watched 2.5 Men. Sorry, Ashton. So I was thrilled to see Sheen on a recovery podcast. He was looking healthy and sharing key insights into his own addiction and recovery. My biggest takeaway from the interview was a relapse prevention tactic that Sheen uses whenever he gets the urge to drink or use drugs. Sheen calls it the Shiver. The Shiver is easy to use, powerful, and when executed efficiently, the simple technique can often evaporate an individual's urge to drink alcohol, take drugs, gamble, binge shop, binge eat, engage in risky sexual behavior, etc. However, before I cover the mechanics of this technique, I feel it's important to frame some of the main obstacles that are typically encountered in early recovery, as doing so will assist you to identify where the Shiver fits into your overall recovery capital, discussed later. A brief frame of early recovery obstacles and pitfalls. For most of us, the first couple of years after quitting alcohol and/or drugs can be trying to say the least, especially for individuals that have endured long and severe cases of substance use disorder, SUD. Additionally, a significant number of people in this early recovery phase have co-occurring disorders such as social anxiety disorder, SAD, generalized anxiety disorder, GAD, bipolar spectrum disorder, BSD, major depressive disorder, MDD, post-traumatic stress disorder, PTSD, chronic fatigue syndrome, CFS, attention deficit hyperactivity disorder, ADHD, chronic pain, fibromyalgia, or one of the many others. For individuals with one or more co-occurring disorders, early recovery is often tricky, having to withstand and outlast post-acute withdrawal symptoms for weeks to months or longer, and then stubborn neural pathways of addiction that won't fade away fast enough, months or years, is often the most difficult challenge an individual will face in their lifetime. This is often more testing with co-occurring disorders, or comorbidities, especially if the person has not found an adaptive versus maladaptive coping tool for managing their anxiety, depression, chronic fatigue syndrome, ADHD, panic disorder, borderline personality disorder, or back pain, for example. In my own experience, the mental issues that plagued me were often my reason for consuming alcohol or administering drugs. Sure, when I was younger, I was drinking and taking drugs to get high with friends or as a remedy for boredom, but it wasn't long before most of my substance use centered around self-medicating my chronic anxiety, intermittent depression, trauma, and general fear of life and people. I've worked with hundreds of clients that got addicted to pain pills simply by taking them in the way their doctor prescribed, and some of these folks have told me they have no anxiety disorder, no depressive disorder, literally no psychological issues whatsoever. In these cases, if they no longer have significant pain issues, detoxing from opioid analgesics and staying opioid-free is often a more straightforward process than it is for individuals that have an anxiety disorder, post-traumatic stress disorder, or bipolar spectrum disorder, or another co-occurring disorder, for example. In early recovery, stress is often the number one slip or relapse trigger. Work stress, relationship stress, financial stress, stress from politics, COVID stress, single parenting stress, domestic duty stress, automotive repair stress, dental work stress, health issue stress, bills, emails, phone calls, errands, chores, appointments, responsibilities, commitments. The list goes on and on for many of us. However, while our brains are innately resilient, addiction can rewire the brain in a plethora of devastating ways that are chronic, debilitating, and free will depleting, especially in cases of severe and long-term SUD. Fortunately, with an effective, individualized, and holistic treatment plan combined with commitment, diligence, patience, consistency, self-compassion, and resilience, a person can successfully heal their brain, body, mind, and soul over time using a blend of integrative strategies, like therapeutic counseling, recovery coaching, a strong support system, nutrigenomics, epigenetics, neuroplasticity, and much more, the latter two of which are some fascinating new areas of research that are helping people recover from addiction and other health issues at elevated rates. Chris Scott's Total Alcohol Recovery 2.0 program, for example, strategically guides its members step by step on how to break free of the alcohol addiction cycle using the hierarchy of alcohol recovery and all of the above-mentioned strategies, as well as many others. And my course, Ultimate Opioid Detox, does the same thing for its students, using the hierarchy of opioid recovery and the phases of recovery as a model for transcendence. It would be an anomaly if someone went to a mainstream residential rehab program and learned how to properly harness the power of nutrigenomics, customized diet, exercise, supplements, and other health habits to rebalance the chronically dysfunctioning, addicted brain. These concepts simply aren't taught in mainstream recovery programs, which is sad because from what my colleagues and I have witnessed, recovery rates skyrocket when you correct the severe neurotransmitter imbalances and other chronic brain dysfunctions that prolonged use of addictive chemicals either caused or exacerbated. Enter the shame shiver. The shame shiver is simple enough to use, and learning why it works as well as how to use it can provide a valuable asset to your recovery capital. In early recovery and beyond, the more recovery capital you have, the better. Recovery capital is the depth and breadth of internal and external resources that can be used by an individual to initiate and sustain recovery or wellness from addiction. Here are some examples of recovery assets, resources, that build recovery capital. Physical, safe place to live, reliable transportation, money to buy necessities with, healthy foods, high-quality supplements, Peloton treadmill, Bowflex home gym, 2x per month appointments of deep tissue massage, superfood powders, alkaline ionized reverse osmosis water filtration system, infrared sauna, blue light glasses, Vitamix blender. Psychological, growth mindset, internal locus of control, 100% responsibility frame, realistic optimism, therapeutic counseling, hypnotherapy, resilience, neurolinguistic programming, NLP, mindfulness-based therapies, MBTs. Social, compassionate, loving, and understanding spouse, a tight support group, healthy relationships with coworkers, love and connection with friends and family, play, cuddle, love time with pets regularly. Spiritual, faith, a daily meditation practice, morning prayer and worship routine, member of a Bible study group. The shame shiver falls under the psychological category of recovery resources. Charlie Sheen says that any time he gets an urge to use addictive substances he has sworn off, he activates the shame shiver. Here's the 3-step framework of Charlie Sheen's shame shiver process. 1. A thought, impulse, or urge to use drugs and/or alcohol occurs. 2. He notices the urge, yet instead of giving into it and compulsively acting on it, as he often did in the past, he shifts focus from negative thinking and fantasizing about using to feeling gratitude for everything good in his life. To systematically and quickly deactivate the craving or urge or thought to use, Sheen transports his consciousness into his mental movie theater and plays a series of 3 montages. These montages are the 3 most shameful events from his addiction. These mental reruns are so realistic, Sheen says they literally cause him to shiver with shame, which makes perfect sense as research has shown that our brains cannot perceive the difference between a real event and something intensely imagined. In Sheen's case, those events did take place, and he's simply accessing those memories to access the feelings of shame he knows will help him stay off alcohol and drugs. I highly recommend the shame shiver as an adaptive coping tool and powerful asset for building overall recovery capital. And remember, the more recovery capital a person has, the easier it is to initiate and sustain recovery, and hopefully fully recover from addiction. Pain avoidance drives behavior. Everything we do in life is either to avoid pain or gain pleasure, and we will often do much more to avoid pain than we will to gain pleasure. The shame shiver is a technique that taps directly into the brain software of human behavior via the pain-pleasure principle. When Charlie Sheen uses the shame shiver, his 3 montages invoke so much shame, a form of pain, that he physically shivers. That pain is real, and he feels it, associates using alcohol and drugs to causing that pain, and since he links so much pain to drugs and alcohol after doing the shame shiver, that pain is enough for him to avoid using drugs and alcohol. To change any behavior in life, you must associate massive pain to doing the behavior and massive pleasure to abstaining from the behavior. If you link more pleasure to the behavior than pain, it'll likely be impossible to quit or at least stay quit. However, if you're able to rewire your brain permanently to associate massive pain to the behavior, e.g. drinking alcohol, and massive pleasure to the benefits and lifestyle of not engaging in the behavior, you'll have a much easier time abstaining from that behavior for life. Here's the formula. The behavior you want to abstain from equals massive pain. Not engaging in the behavior equals massive pleasure. Pro tip. The best neuroassociations for abstaining from a behavior are to link a 10 out of 10 pain to the behavior and a 10 out of 10 pleasure to staying clear of the behavior. The worst neuroassociations would be a 0 out of 10 pain linked to the behavior and a 10 out of 10 pleasure associated with it. Shame can be a trigger or safety switch. Shame can act as a trigger for many individuals to use alcohol and/or drugs to numb the pain of shame. Shame is a painful feeling of humiliation or distress caused by the consequences of wrong or foolish behavior. In my 44 years on this planet, the worst agony I've felt is opioid withdrawal, and the second worst I've felt is shame from things I did drunk or loaded. I would often numb the pain of my shame with alcohol and or other addictive substances, promiscuity, television, video games, cookies, brownies, ice cream, pornography, and many other forms of numbing and escapism. However, Sheen teaches us that shame goes both ways, and he has learned how to activate deep feelings of shame at will, then link the negative feeling state to using booze, blow, and other drugs, which helps him to avoid relapse and thus avoids future shame. Conclusion. If you're a fan like me, then you're on cloud 9 to know that Charlie Sheen is sober and doing well. If you're not a fan or can't forgive his past transgressions, I understand. I've done so many things in my own past addiction that were so shame-inducing that I have no right to judge. One of the many things clients have mentioned consistently over the years is that they love how they can tell me anything and I won't judge. Only a person that has been afflicted with addiction can fully understand what it's like to have a brain that says, go, 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 and rarely tells you to stop. This is the result of drugs and or alcohol hijacking the midbrain, survival-based, and eroding the function of the prefrontal cortex, higher reasoning, decision-making based. These two issues alone can make alcohol use disorder, AUD, or drug addiction feel like driving a car without brakes. You might want to stop, yet with no brakes or damaged brakes, eroded prefrontal cortex, it's not easy to stop. Finally, it's important to note that the shame shiver won't work for everyone. For individuals that haven't done anything highly shame-invoking, this probably won't work. Additionally, it's not a technique that you want to be dependent on forever. The key is to design a healthy lifestyle and routine and keep making progress in recovery so that eventually you no longer experience urges, impulses, cravings, or even thoughts to use substances or engage in behaviors you've committed to abstaining from. But that can take time and consistency. Luckily, until that day comes, now you have one more asset to build up your overall recovery capital. And remember, the more recovery capital you have, the easier it is to initiate and sustain recovery, and hopefully fully recover from addiction. If you have any shameful events from your past that were caused by drinking too much alcohol or using drugs or another behavior you've committed to abstaining from, now you know how to use the shame shiver for relapse prevention. And as far as I'm concerned, when Charlie Sheen stated he was winning, he was actually losing health, losing credibility, losing trust and reputation, friends, film roles, dignity, brain cells, teeth, and more. After watching his recovery podcast interview, it seems to me that Sheen understands this better than anyone. In the interview, he mentioned that he'd like to get acting roles again because he feels this is his gift to contribute to the world. I wholeheartedly agree. However, in my opinion, even though he's not starring in blockbusters or hit shows these days, the fact that he's addiction-free, staying on the path despite how hard it can be, and even sharing his story on podcasts, that is true winning. What's next for Charlie Sheen? Will we get the privilege of seeing Charlie Sheen in more of these recovery interviews and discussions, as well as in a Major League Part 4? I think the world could benefit from both of those quite a bit. And since the recovery podcast I saw has so many views and spectacularly positive comments, it's obvious to me and many others that Charlie Sheen is just what the quote-unquote recovery community needs right now, especially after the U.S. overdose death rate spiked well over 100,000 people and rates of all addictions across the board increased at alarming rates. And with that being said, thanks so much as always, my friend, for listening. Take good care of yourself, and I'll see you next time.